How you doing?
Khaled, how are you?
Good, good. So let's start off in a lighter note, and then we'll get to the harder stuff. But I hear that hair salons are opening. How happy
Yes,
are you with that?
I'm happy. Like this is tough to keep together right now.
So, okay.
How happy are you about getting hair salons?
I haven't been to a barber chair since 1999, so so let's get to the tougher stuff here. Let's talk about the new Brampton Hospital. Now I gotta ask, okay, because I did have Guratan Singh on with me a couple hours ago, and he said that there's actually in the document he pulled out, there's no actual new hospital for Brampton, just 250 beds and an extension to the old one. What do you have to say to that?
I think he's confused
Okay.
because the premier had the press conference today. This is a full commitment to phase two. Phase two is a $700 million project that includes 250 plus beds, a full service emergency department. This is the application that was put in by the hospital and approved. And it's actually a much more muscular proposal than had been a year ago. A year ago, City Council met with the board and said that it needs to be more aggressive. We wanted to add an emergency department to it. So, we got a home run. We got the emergency department. We got the increase in beds, and they're going to start construction as early as next year. So I'm a
Nice.
pretty happy camper.
So let me ask you this. There is going to be an emergency room at this new hospital, correct?
Yeah, yeah. That's what the Ministry
Okay.
of Health is saying. That's what the Premier is saying. That's what the hospital is saying. That's what was in the application. So I was a little bit confused about why some opposition politicians were suggesting otherwise. Because, Khalid, I am a partisan agnostic when it comes to municipal politics. My job is to fight for Brampton. I don't care if it's red, blue, or orange. My job is to fight for Brampton. And, there have been times when I've called the government out. I've been very critical on vaccine rollout, on paid sick days. But in terms of getting a hospital and a med school and a budget, it's a home run. And rather than trying to pour rain on a good news day, I think this is something as a city we should rally behind. This does not happen very often. This is very special and very unique.
When do you think we could accept the first patient to this new bed? When do you see this?
So that's what they're going to be working on right now in terms of the construction timelines. I expect construction will probably start next year. And then building a hospital is not something you do in a matter of weeks. It's a big project. But what I'm hearing from provincial officials is they've got the order to do it as quickly as possible.
Now, and let me ask you, is this the right spot for the new hospital?
Yeah, so if you see the big empty field in front of the current urgent care clinic,
Yep.
the space we have there, I think having it there is perfect. It's a great spot.
Okay. Let's talk about the Ryerson Medical School, another big win. Tell us about that.
So, like I said, I felt like it was my birthday on budget day. To get a med school too was phenomenal. The last medical school announced was 15 years ago, the Northern School of Medicine. It's not something typical to get a med school announced. But Mohammed Lashmi, the president of Ryerson, have been working closely with me on this. We are pushing the government. And just to think how beautiful it is that there's going to be kids that grow up in Brampton, go to med school in Brampton, and then work at the new hospital. That's just awesome. But let me say this. I'm ecstatic we're getting a med school, but that doesn't mean I'm giving up on getting our own university. I'm still committed to Brampton University. We're the only big city in the country that doesn't have our own university. So this med school is awesome. It's a home run, but I also want to see a university down the road.
Awesome. And then let me ask, is this going to be this medical school? Is it going to be its own standalone building, and do you know where it will be?
So Ryerson has expressed an interest for it to be in the downtown, likely close to the new hospital. But those details are still being worked out. They got a planning grant for this, so it's great news. I had some friends at Queen's Park text me and say, "Is this the Ontario budget or is it the Brampton budget?"
That's a good thing. So, I have to go back to the broken record questions that I ask you every week. We're actually approaching 20 weeks now in lockdown. 20 weeks, if you can believe it. Are we any closer to red, or are we closer to a stay-at-home order?
So I really want us to be in red. I think this lockdowns can't be normalized. But public health seems to be really concerned about the spread of the variants. The variants only a few weeks ago were 5% of our cases. Now they're half of our cases.
Sure.
And so what's been explained to me is they're not going to consider moving us into red until the reproductive number is below 1. And right now, the reproductive number is the highest in Mississauga, second highest in Brampton, and then Khaled, which is sort of interesting because it used to be Brampton had the higher reproductive number, then it was Mississauga, then it was Khaled. And so we're seeing some unusual growth because of the variant. And in the red zone, you're supposed to be between 0.4 and 1, or 0.49 and 0.99 reproductive rate.
Yeah.
And we're all 3 municipalities are over 1. So, we got to get the numbers down. But I had expressed frustration that you can't have people in personal care services shut down permanently and outdoor activities shut down permanently. That's not good for mental health. And so at least today they announced that personal care services will be open again on April 12th, and outdoor fitness will be allowed starting March 29th. And so those are two things we pushed for. And so I'm happy that we got those.
Are you going to be doing any outdoor fitness?
Yeah, absolutely. I love my exercise. So, but I'd say it's not just about what I love. It's about. I wish this was a few weeks ago. We could have played some outdoor hockey. We got these beautiful outdoor rinks in Brampton, which we weren't able to use this winter. But I think of all these groups right now. Our bylaw officers tell me, they're like, Mayor Brown, the provincial rules say we have to shut down this cricket game or shut down this game of kids playing soccer. And I just feel horrible about that because the public health data does not support shutting down outdoor recreation. So now, because of this, those cricket games, those soccer games, they're going to be allowed. And so, that's good news.
Let's talk about the vaccinations. Have you any update on the drugstore pilot program coming to Peel or Brampton?
Yeah, so they've agreed to add it to Peel Region as soon as the next AstraZeneca batch of vaccines arrives in Canada. And so here's the tricky part. They don't know when it's going to arrive. It could be any day. And so they're waiting. If it arrives tomorrow, then they said two or 3 days later, we can start on pharmacies in Peel. But they're waiting for that vaccine shipment, and they can't get an answer from the federal government on when the vaccine shipment's going to come.
Okay, that is frustrating.
So I actually talked about it this morning with General Hillier because we were at the same announcement together. He said it's all about supply right now. He says we're ready to let you guys go as soon as we get supply.
Has he heard anything? Has he heard when?
He said it's frustrating. He says he wants to know when the shipment arrives, and he says the government of Canada won't give him a date.
Interesting. Okay. My mom got the shot. The vaccine, right?
By the way, my mother got the shot this week too. So.
Oh, okay. Yeah. So when is her second shot? Because
isn't that awesome?
It is awesome. It's great. The only thing is, though, my mom's second shot's not until July 5th. I don't know about your mom.
That's the public health advice. The National Advisory in Ottawa said that you get a level of immunity for a period of time, and that was the Canada public health advice to spread out the shots.
Okay. I have a feeling
that's of course not a decision we make locally. That's a decision it's based on recommendations from scientists and physicians in Ottawa who are on that National Advisory Council.
Okay. There are vaccination centers in Brampton. Are they sitting empty right now just because there's no vaccine?
Yeah, so let me put it into context for you. We get a few thousand vaccines a day right now that we're getting out. And people say, oh, Mississauga gets 2,000, Brampton gets 2,000 today, and that's pretty good. No, it's not. We could do 70,000 a day. So we're celebrating, we've gone from 1,500 to 2,000. No reason to celebrate. We've got the capacity to do 70,000 vaccines a day in Peel Region if we had supply. But we don't have supply. They've got vaccines in 54 other countries at a higher rate than Canada. Think about that. 54 other countries have more vaccines per capita than Canada. And for me, that's frustrating.
And last thing, the Amazon plant, it's scheduled to open back up next week. Is this confirmed? Do you have any updates in regards to that?
So the closure was a 14-day closure order, which I supported. and now they're going to be reopened. But I think a pretty strong message has been sent. No company is exempt from the public health rules. Every company is going to be responsible if there's outbreaks in their facility, no matter how large or influential that company is. And so let this be a message to every other logistics or food processing company in Peel Region. I know you're critical to Canada's supply chain, but there will be consequences if we see outbreaks.
So can you confirm it is opening next week?
So the closure order was for 14 days.
Yeah. Okay.
So as long as Amazon wants to open again, which I assume they would, their closure order is over after 14 days.
Okay, perfect. I don't have any more questions. Anything you want to talk about or comment on, or?
No, I can't wait till April 12th so I can get a haircut.
Okay. All right. Mayor Brown, thank you so much. Have a good weekend.